that anchor the shoulder blade into the trunk. We wanna, when we look at this upper extremity, this arm, we're gonna start with the shoulder blade, and we have a clavicle in the front. But the clavicle is really flat and just sort of hold, well not just, but one of its main functions is to hold the shoulder blade back in a position that it doesn't fold forward. So it holds it sort of out that way. And then from the shoulder blade, we can attach an arm, and from there then we can move an arm and get the elbow and the wrist and all that stuff going on. So this is really the important part here, is that we have that shoulder blade anchoring into that rib cage, and then the arm will attach to the shoulder blade. So when I look at muscles, I first on the list have muscles that are anchoring muscles. I call them because they anchor the shoulder blade into the trunk and hold it firmly, that upper extremity firmly in. And that's the serratus anterior coming from the side, the levator scapula coming from the back end of the spine, the rhomboid's doing the same thing, and then the pectoralis minor from the coracoid process holding the scapula to the front down and anchoring it in that way. So now we have a muscle here holding it in, a muscle here holding it in, a muscle here holding it in. That's pretty solid, that's pretty good. So when we go through then, here we have the levator scapula that attaches shoulder blade up, reaches into the neck. And then these are just trigger, this is in the booklets, right? The trigger points where pain patterns happen. I put that all in there. And then we go further down here, it's on this side now, the scapula, the levator is up here. We go further down and get to the rhomboids, and the rhomboids hold up into the spinous process. So these muscles feed from the medial border of the shoulder blade into the spinous process and hold it in this way. So that gives us the rhomboids, the levator scapula. And then if we go further down here, we have the serratus anterior. That's one of my favorite muscles. That muscle is from, if you take a shoulder blade and you flip it back, that muscle is underneath on the medial border. Like here underneath it is, like inside, it's where it attaches underneath. So we flip that back. And then from there, it reaches into the ribs and grabs onto the ribs like that. And then you see that these finger-like things coming out, or here it's very nice the way you can see it. And then that anchors and attaches and holds that shoulder blade firmly onto the chest. And if you got a winging scapula, a shoulder blade that flies around a little bit and is loose, very likely this muscle is not really that strong or working. You know, mine is very loose, but I can still do push-ups. And that's how you can strengthen is you do planks and hold the shoulder blade against the chest. Don't let it fly, go backwards. So that's the next one that anchors it there. And then we have the last one on the shoulder anchoring ones. And that one is from the front here, the coracoid, going down into the ribs and anchoring the shoulder blade in that way. And so that's pretty solid and nice. It's the pectoralis minor because the pectoralis major is the one that everybody understands, the big muscle here, the chest muscle. And that's overlying it. That's one that comes next. Because the next set of muscles now that we do first is the ones that hold the arm into the shoulder blade. Because now, and sort of, they're attaching the arm into the shoulder blade. They move it a little bit, those muscles. They move the arm around a little bit, this way, I'll show you that in a minute. But mostly they anchor they hold the humors. They come from both sides of the shoulder blade and attach to the greater and the lesser tubercle and sort of hold the humors from both sides into the glenoid cavity that way, into the little shallow depression. And when you see this shallow depression here, it's what's actually around it is a cartilage ring that makes it more like this, but it's cartilage. So it holds, it's called the labrum. And that often gets torn. If so, end range, and then a little too much, it can break. It's like, Tupperware type cartilage, you think of cartilage that way. Those muscles are the sits muscles, the rotator cuff muscles. And we got 3 on the back side of the shoulder blade and 1 on the underside on the one facing the rib cage of the shoulder blade. You identify the back side of the shoulder blade by this ridge, by the spine of the scapula. That's right here. And then you learn you have a supraspinous fossa and an infraspinous fossa and a subscapular fossa. I don't know. But the muscles that are in those fossas are named supraspinatus for the one in the supraspinous fossa. So that's nice and convenient. Infraspinatus for the one, the big one laying down here. And then subscapularis for the one laying on the inside, the subscapular fossa. And then we got one small one, it's called the teres minor, and that attaches right out here. Yeah, you see down in here, it's like, it's sort of on the outside border of the shoulder blade, a little bit up from the inferior angle. Sorry, I cut that off there. A little bit up, because then we have another muscle further down, and that you can see that goes a different direction. If you look at that muscle, that's a different functional muscle. We do that in a minute. Okay? When we move the arm around, that comes into play. Well, hello! How are you?
I'm great.
Good! And then underneath, you got this broad one that comes from underneath here and reaches into the front side of the humerus and sort of grabs it from that side over here. So you got the bone in between. Well, this muscle is really, really, really important in treatment because it's really hard to get under the shoulder blade. But it's often very, very stiff when people have shoulder problems because it tries to hold it in and protect it. That's what its job is. And so besides the job of holding the arm in, did that make sense?
Yeah.
Good. We also, yeah, please ask questions. I love questions. When we look at them individually, we also see under action, we rotate humerus laterally. That's this motion. So we turn the arm outward. So if we take the ones in the back who are attached out here, and we contract them, that will bring the arm this way outward, if I can do it right, this way outward. The ones in the back, they pull. You always think, when you think muscle, motion, action is the action, right? You think when the muscle shortens, with the 2 points they attach and when it shortens, what will happen? We could make it a little fun game, make a stick figure game and see like, what will happen? You could bring it closer together, like, oh, that might be what will happen. When you read those words, that's what you kind of want to try to visualize, you know? That's that. And you can do that when you do this. You internally rotate your elbow, so you do this motion. And that's the muscle that's underneath here, goes in here. If that muscle contracts, it does this motion. So that would be internal and then external rotation of the humerus. So the infra is in the back, and then the subscap. The reason I'm showing this is because this motion here, bringing the arm over to the shoulder blade, if you can touch your shoulder blade, your test is okay. That's a test to test how well this muscle works, this underneath the shoulder blade muscle. See how big it is? It's huge. That's the rotator cuff. We have the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. And together we call them SITS, S-I-T-I-S muscles, for all the first letters. That's another acronym that they use for that. And from there then, now we have the shoulder blade anchored, we have the humerus anchored. Now we can move that thing around. We did this motion, so that's all right. It's a little bit. Thank God we have more than that. So how are we going to move that around? We've got a lot of motion activity over here. Lots of motion. But for sure we're going to bring the arm out. We're going to bring it back down. We're going to bring it forward. We're going to bring it back down, backwards. So those are sort of the motions we've got to do with that. Let's first bring it out. So if you want to bring it out, we've got to work with the muscles here. That makes sense, right? Some muscle attach here, go down. If they contract, that probably brings the arm out. Now that muscle is really cool. That's a deltoid. That's the pocket muscle up here. It goes all the way around from the back to the shoulder, the scapula, the spine scapula. Then the tip is the acromion process. This here, this flat thing, remember from studying that? This part is acromion. And then it goes to the front where the clavicle comes in. So it's a very broad muscle, and it does this motion, brings it out laterally, but it also does this motion, the front part, and also this motion, the back part. So it's a really good muscle doing a lot of things. The one thing it cannot do, and I explained that this morning with the knee, The problem with that muscle is it's attached right here and then goes right down, straight down here. Into here, anchors into here. So it goes deep up and then goes in like that, attaches. So if it contracts, it does this. So that muscle needs the supraspinatus here that attaches on the supraspinous fossa into the greater trunculum. When that contracts, it does a little bit of this too. So that helps to bring the arm out a little bit, abducted a little bit, 30 degrees. And then at that level, the deltoid has strength to pull it up and can use it. So the reason why I'm telling you that is when people have a frozen shoulder, they usually have a frozen shoulder very often, most often it's in the supraspinatus, because the outside third of the supraspinatus, the rotator cuff injury, not frozen shoulder, that's a rotator cuff injury. But the outer third is avascular and is not vascularized. So what that means in medicine, when something doesn't have blood supply, that's what vascularization means, it doesn't heal fast. It's slow in healing. So very often that muscle here, it always works, it wears out. And so you see these people, they can't do this. They can do this, or they do this. But they can't do this by themselves. They have to have assistance to do it, and then they can do it. Then the supraspinatus is not quite there. So the deltoid is a fantastic muscle. Very cool muscle. And it goes, and you think it goes it's just up here, the way it looks, but it actually goes all the way half to the humerus. So you can feel it on you. If you feel that bump here, that's the bump right here. That's the deltoid tuberosity. It's often a little tender. And then from there we want to, we brought the arm up. We have also the coracoid brachialis that helps with that a little bit, bringing that arm up like that. That's its function too, a little bit. That was the deltoid. And then now what we're going to do is we have to bring it back down into the front. We want to bring one down to the front, and we want to bring one down to the back. And the one in the front is the pec major. That muscle is all attached all the way here, clavicle, sternum, ribs, and then goes right into the inner tubercular groove, which is right in here. Right in here. I think on the outside, actually. If you really go very, very fine. That's where these pictures are. So you see the attachments on the pictures? That's where you can see the attachments real nice. Because it's more important to see it than know what it's called, at the end of the day. And so then that muscle contracts, it brings the arm down and forward. And it actually brings it inward a little bit too. So it does that motion. Adduction and medial rotation. And so that's a pretty good motion for the humerus. And then the last one I'm going to talk about, I think, is the latissimus dorsi. And that muscle is attached all the way in the back. Look at this broad attachment here in the back. It's huge. And then it goes pretty much to the same place in the inner tubercular groove. And when that contracts, it brings the arm down and back, not down into the front. So it's down and back, not down into the front when that contracts. So that's why this muscle is huge. Look at it. And these are also Olympians. It's just huge. It's amazing. And that's why, because you can do the crawl real well. That's exactly that motion that that muscle does. And so that's very, very accentuated. So it's attached in here. Also the ribs a little bit on the shoulder blade. And then it goes into the inner tubercular groove here in the front. And when that contracts, it forcefully pulls that arm down and back. And then we have a little helper, and that's where the teres major now comes in. And that attaches at the shoulder blade and goes to the same place. It's kind of like, if you think about it, the latissimus dorsi comes from up here and goes into there. It goes and covers the shoulder blade. So you're going to have one that attaches to the shoulder blade and goes with it and helps it. Because we want to be forceful. We want to pull on everything we got. That's an important function. Swimming is important if you need to, swim away from a shark. So now let's take a moment and look at these muscles on some models. The serratus anterior, I can only see that on this model. And I can see that where I see these coming into the side, these muscles here, they reach underneath to the shoulder blade that I can't see, but these are the serratus anterior muscles, right here. You can see them where they go over there. On this side, they're here too. You can see them here. You just don't see the attachments in the brace. And then the next one that we have a hard time seeing is the levator scapula. We can't really see any, but that's attached here underneath. What we can see is the trapezius. So if we take the trapezius away, then we have the levator from here going up. So obviously I can't tag it, so it's not going to be tag. However, it's a very, very important muscle clinically, and that's why I want to make sure you guys know about it, because it's the one that holds up the shoulder blade. So that, you know, if ever you tie it without anything here or here to sort of and too long, and you do this, it's going to get tight. So you got to figure out how to drop that thing. And if somebody's really good with massage, they can go right here and rub on it and just rub on it. It really helps to release that tension. And then the same as with the rhomboids, they go in like that and they hold it in from the shoulder blade edge, medial edge, inward to the spine. And when we look at the sits muscle, the rotator cuff muscles, I'm going to have on this model, you can see this is a left arm. And so you always have to make sure you know what you're looking at, because it's very easy for us dyslexic prone people, or me at least, to confuse the sides. So I always want to orient myself where, so this is the right arm, I can see the thumb, I can see the finger, I can put it on myself, so I make sense the shoulder blade's in the back, the collarbone comes out the front, and then I know where I'm at. But then I can sort of start thinking. So let's take away, this is the deltoid. So we actually have that on the list. You see the deltoid is right here. That usually falls off. And then when we look at the backside, you see this ridge, bony ridge here. That tells you it's the backside. That's the spine of the scapula. And on top of the spine of the scapula, we got the supraspinatus. And again, on the test, I'm tagging it, and you're telling me what it is. I'm not asking you what it's doing. We do that another time. That's cool stuff, and that's important. But I want you to understand what it's doing. I don't want you to memorize that and then just know a word or two. Just understand it. So the supra is up here. Then I jump over that bony ridge. I go to below. That's the infraspinatus. And then now it gets interesting. I got these two here. I got one that you can see goes right with the infraspinatus, right to the outside of the arm, travels with it, even though it sort of looks like it goes underneath. And then you got one that travels underneath the axilla, goes right into the armpit. And so those two you differentiate. That's a tricky one. The small one that goes with the infraspinatus, that's right after the infraspinatus, that's the teres minor, because it works with the sits muscle. Functionally, it makes sense that it would just travel together. And then the lower one that goes deep, that's the one that works together with the latissimus dorsi muscle that does this. So it's got to pull on the humerus from the inside, so it goes into the intertubercular groove. So that's the teres major, the one on the bottom. If that was too much, just know the one right next to the infra is the minor, the one at the bottom is the major. And then we turn it around, and then we have the subscapularis right here. Underneath. It's a big muscle. I'm always amazed that not more therapists work that muscle. It's awkward to get to. Still got to work it. And then what we got there? We got then the pec major, the coracobrachialis, and I already talked about the deltoid. So the deltoid is this muscle here, this pocket muscle, the shoulder pocket muscle. And then the coracobrachialis, if you look at, again, that's the clavicle. You gotta go below the clavicle, you got that bump. That bump is that coracoid process. If you do it on yourself, here's the humerus. Right next to it, you have a little indentation, then another shallow bump. And if you poke it hard, it hurts a little bit. That's the coracoid process. And that's this, and then from that one goes, the muscle goes right down there onto the inside. That's the coracobrachialis. And then we got the pec major and the latissimus on this first set of terms. And the pec major is right here, the big front muscle. And then the latissimus dorsi, it's a really hard one, we can't really see it. It's taken away here. So it goes from all the way here and goes underneath. And you can sort of see it here, and you can see it here, where it goes underneath. You can see that piece here, but I'm not going to attack that piece. That's like nasty if I do that. What's this one? Well, everything is caught away. What do I know? How would I know? So, but that's where it is. So that's the latissimus dorsi. So then from there, we're going to start moving the arm around. No, now we're moving the elbow around. Now we're basically going to do this and this. This and this. That's about it. We do more down in the forearm, but up here we do this and this. So the motion is really flexion and extension. We got a few muscles to flexion, and we got a few muscles to extension. In the front, we got the biceps brachii. That's the biceps. Everyone know the biceps. There's this one, right? I know it used to be there. Now it's here when you do this. And below the biceps, we got the brachialis muscle. So you have the biceps here, and you take that away, and underneath it you have the brachialis muscle that attaches that mid-shaft humerus and goes down into the forearm. When we look at the model, we have here we had the coracobrachialis, and then next to it we have this two-headed one that comes off. That's the biceps brachii. And if I take that off, you see underneath, that's the brachialis muscle. And so that's pretty good for this part of the forearm here. And then we're going to turn the thing around and go to the back. And in the back, we got one big muscle. And that one big muscle in the back is the triceps brachii. That's this one here. So if something is tagged in the back, you just have to make sure you orient yourself. You know, the front is where the thumb is. Anatomical position, thumb out, palm forward. All right, everything is in anatomical position. And so the front is here where the thumb goes. The back is where the pinky is. The triceps in the back. The biceps and the brachialis are in the front. Then from there we go to the forearm. We got one player here that's a little bit of an oddball, because it's really actually, we think of it as a forearm muscle, but it reaches all the way up to the lower humerus and sort of does a little bit of that too, but quite weakly up here. This is a good picture because you can see it attaches here and then goes all the way down to the styloid process. So it goes from here all the way down to here, and it does this motion, but it really does also this kind of motion. But this is abduction kind of motion. It's not on there, but that's sort of like when we hold something up and we have to hold it tight, you know, that kind of thing. That's like this muscle. Or that's called, when this muscle is in trouble, it's called the tennis elbow, because they do this motion. This sort of motion really stresses this muscle. So that's known as the brachioradialis. So this is a good one for the words, because when you confuse, you go like, well, this is in the brachial, so it starts up here, and it goes towards the radius. That's the thumb side, along the radius really, so they call it radialis, brachioradialis. So that's the last one of the brachii muscles. So we had the coracobrachialis, the biceps brachii, the brachialis, the triceps brachii, and the brachioradialis. Lots of that. But the good news is, the reason I'm saying that is, if you see the word brachii, you know it's over here. That's the pathway the brain needs to go. Not just data points and then like, oh my Lord, it's more like find pathways to make the web of information, and then it becomes easier and easier to get more into it, or more knowledge attached to it if you have to do that. Or if you want to. I'm fascinated. I've been studying fascial lines through the body more and more. My treatments are changing in my patients. It's very interesting. 30 years later. Oh yeah. You always grow, you never stop growing, that's for sure. And let's look at the brachioradialis on here. And the brachioradialis on here is right here, where you see that nerve coming up. And you see the top muscle that's fairly wide. For the forearm muscle that's fairly wide, and broad. It goes down towards the thumb, and then it goes on. That's the brachioradialis. And then let's just stay on the model for a moment. Then we have some muscles that we studied that are back here, on the back side of the hand, or the forearm. And then a bunch that are in the front side. And then when we take some of these off and away, underneath them we have more muscles, but we don't study them. So we're going to close that back. That's sort of the next time around. But for the most part, when I work on people, it's really those are the most muscles I work on. Maybe the finger moves a little bit, but the hand is really complicated. Okay, so now we have the muscles on the back side of the hand are extensor muscles. They do this motion, and the ones on the fore side are the flexors. They do this motion. The ones on the anterior side of the forearm are much stronger than the ones on the back side, because they have to hold things. We usually hold things this way, not this approach. Oh, that would be a good exercise. But probably wear out pretty fast. So these are much bulkier. So we're going to study 4 muscles in the front, and we're going to study 3 muscles in the back. So we're going to go with the front first. So in the front, we got the flexor muscles, and we also have a muscle that does this motion, that pronates, not forearm. So we have that too. So we study 4 muscles. We study the pronator teres muscle, and that attaches, this is the forearm, that attaches an medial epicondyle. This is a right arm. So this is the other side of this. See, that's where it's confusing. The pictures and the models are often the opposite sides. Like, why didn't they come up with it? This is the medial epicondyle here. This is the same side as this arm here. And so the muscles that are in the front side, for the most part, but specifically the ones we studied, the first 4, they all start in this area, in this medial epicondyle. So that's sort of our common origin. And then it reaches across, fairly steep for diagonal, but it's fairly steep across from the ulnar side to the humerus side. And now all you got to do is say, oh, what happens when it shortens? Goes down. The palm goes down. And that's pronation. So that's this motion right here. The muscles attach here, and then go. I don't know what they get. And then go across here. Now I can't hold it. There we go. From here, and then goes across to here, and then it contracts. It does this. And it rotates the humerus, and it rolls the radius over the ulna, and it crosses it like that. And that's actually the reason why the anatomical position is this position. Because this is when the bones are crossed in this position, and in this position they run parallel. So, long story short, the pronator teres is one of 2 muscles. We have one down here too. We don't worry about that. We worry about this up here that turns the palm down. And then we have 3 more that we concern ourselves with in the front. We have the flexor carpi radialis, the flexor carpi ulnaris, and then the last one we worry about is the palmaris longus right here. So those muscles are all in the forearm. Now we go back to the model. So those muscles are all in the forearm. So the first one we had, watch this, just right here, the pronator teres going right across. And then the other one, see, one goes like here to the thumb. See, when you follow the fiber, it goes towards the thumb side. Which bone runs towards the thumb side? The radius. All right. And then we got one here in the middle that goes right into the palm of the hand. And then we got one on the outside here, and that goes to the pinky. And which bone runs by the pinky? The ulna. So now we have all these forearm muscles, except for the pronator. The other ones, they flex. They flex the wrist. They bring it this way. They close the ankle. That's what flexion is. And we got one that runs by the radius. We got that flexor, carpis, wrist bones. Radialis. We have one that runs by the ulna. That's the ulnaris. And then we got one that goes right into the palm of the hand. We call that palmaris longus. So we have one right here that goes to the thumb. That's the flexor carpi radialis. It doesn't go into the thumb. It stops at the carp. And then look at the one on the outside. It goes right here to the pinky. So that's the flexor carpi ulnaris. The pinky ulna, the thumb radius. Did I say that? Thumb radius. And then the one in between, you can see how that goes. You see how the tendon, the gray thing, goes across that white thing here. The white structure is called the flexor radiculum that holds all this together. It's like it's a rubber band. And there's one muscle that goes above the rubber band, and that's the palmaris longus. And if you actually do this with your wrist, you can see this tendon here sticking up. That's the palmaris longus tendon. And some people don't have it because it's not the biggest. It does this sort of motion. You know, it's not like it's in the fascia. It's not in the bone. So it's not the biggest, strongest muscle. So that gives us the muscles I want you to know for the exam in the front here. And the way we remember it is we can take the thumb and put the web of the thumb right here by the medial epicondyle and go across with our fingers. And wherever the fingers go, the index goes across, that's the pronator teres. The middle finger goes to the thumb side, that would be the flexor carpi radialis. The ring finger goes right into the palm, that would be the palmaris longus. And then the pinky goes into the pinky goes into the pinky, that's the flexor carpi ulnaris. This is sort of the hardest part of the session, because after that we go to the back side, and the back side is a little confusing. There's a lot of stuff happening in the back side. So in the back side I'm going to ask you for 3 muscles, but really I'm tagging 3 regions, because there's a lot of small muscles. So the orientation point that's important is the brachioradialis. And that's the muscle right here that goes to the thumb. And then we got a few muscles here that go towards the thumb side. And they're multiples. Like this down here are thumb movers. But if I'm tagging this muscle that goes right next to the brachioradialis, these two, I'm going to call this, and these are extensor carpi radialis. So this motion in the back palm here is extension, not flexion. So these muscles are going to be called extensor muscles. So that's another thing. If you see the word flexor, you know it's going to do a flexion somewhere. A flexion is making the angle shorter, closing it in, or narrower, whatever they call it, versus making it bigger. That's extension. And so that, in the head, it's always a little weird, flexion, extension. It only took me a long time to realize. A long time. So if you're a little confused, don't feel like that. It's not your brain, it's everybody's brain. It's at least my brain too, so you can take comfort in that. Alright, so that's the flexor carpi extensor carpi radialis right next to the brachioradialis. And then we got one long one. You see this on top, right on top. You see how the tendons go right into the fingers. You see those gray structures. And that's a neuver. That's the extensor digitorum muscle. You can see the word right here, extensor digitorum, because digits are our fingers. And so this muscle, you can see the tendons goes right into the fingers. Extensor digitorum. I'm putting that here, it's superficial, but also on the front, we also have digitorum muscles. They'll just be called flexodigitorum, and they're underneath, so we don't study those. But you know they're there, just so that you know they're there. And then we got a bunch of, we got this one out here, see this one out here? And that goes, it's a bunch of muscles. There's a bunch of different ones that go, one goes to the pinky side, one goes to the whole digit, still this one. But then we got underneath them, we got some that go to the wrist on the pinky side, and those are the extensor carpi ulnaris muscles. If I tag it out here, it's extensor carpi ulnaris. If I tag it on top, this one you can make out, that's extensor digitorum, sorry. And then if it's on this side and it goes to the thumb, it's either the extensor carpi radialis or the brachioradialis. Now why don't we go to the table and do that a little bit together? Talk about these for a moment. Is that be alright? You guys hungry? they're snapped. So help yourself. But let's go to the table. If you need a break, of course, you take a break. Go breathe some fresh air for a few minutes. But let's go through these together, and then we do us a little quiz thing, a little drill.